basketball is my favorite sport. I like the way they dribble up and down the court.
Alright, well I'm Jackie, and I'm here with one of our men's basketball athletes who took a pretty nasty fall on the ground while attempting to make a dunk. So, can you first start by telling me your full name?
Michael Anthony Dias Jr.
Okay. Do you remember where you were during the fall?
Yeah, I was in bed. I was
Do you
on
want to
the
build
gym set.
Do you know what day it is and roughly what time it is right now?
It's about like 7:30, December 9th. I don't even know if December 9th, if that's the date.
I think it's the 10th, but that's okay. We're gonna let that one slide. Okay, so Michael, I'm gonna give you 4 words. I'm gonna ask you them later.
Okay.
I want you to remember apple,
Yep.
bath, water, and dog.
Okay.
Okay? Alright, so now we're going to test the cranial nerves. Okay, so for the olfactory, we're going to be testing smell. So Michael, can you shut your eyes for me? And I want you to tell me what this scent is.
It's Michael Walker.
Yeah. Alright, for C2 we have the optic. So can you read me the sentence?
I like dogs. I do not like cats.
Good, good. Alright, then we have C3, which is ocular motor. So, I want you to follow my finger. No, that's good, your eyes moved. Okay, so for C4, we have the trochlear. So I want you to, once again, follow my finger without moving your head. Good. Good. Okay, so then for C5, we have trigeminal. So, Michael, I want you to tell me if you can feel this.
Yes. Yes.
A lot more pressure with the beard. Alright, so then we have C6, which is abducens. So once again, don't move your head and follow my finger. Just watch it. Good. Then we have C7, which is facial. So Michael, can you smile? Now frown. Raise your eyebrows. Puff out your cheeks. Can you show me your upper teeth? Now show me your lower. Should have zoomed in for that one. Okay. Then we have C8, which is the vestibular cochlear. So, why don't you tell me if you can hear this?
Yes. Yes.
Good. And then we have the C9, which is glossopharyngeal. So, I would test your gag reflex with, but Michael asked me not to do that ahead of time. So then C10 is vagus. So, Michael, I know you can already speak. We can have a conversation. Can you repeat the sentence that you said earlier?
I like dogs. I do not like cats.
Okay, awesome. For C11, we have the spinal accessory. So, can you shrug your shoulders for me? I want you to resist. Good. And then for C12, we have hypoglossal. So, can you stick out your tongue, Michael? That's an attractive face. Nice. Alright, so what were the 4 words I gave you earlier?
I know 3.
Okay.
Apple, dog, water, suntan lotion. I don't know.
No, it's associated with water.
Bath.
Alright, 75%. Nice. Okay, so next we're going to check Michael's motor system, and we're going to check the muscle size, strength and tone, the gait and balance, and rapid alternating movements. So we're going to start with gait. Alright, Michael, do you mind walking from there to me? You might be walking with some sort of intoxicated walk. Alright, so next we're going to check myotones and dermatomes. Alright, sensory testing, which is the dermatomes. Michael, can you feel this?
Yep.
That's C4.
Yep.
C5.
Yep.
Getting close. C6.
Yep.
C7.
Yep. Yep.
C8.
Yep.
And T1. And then for the myotomes, actually, so if you stand up, and you kind of hard with your hands, so we're just going to keep doing the dermatomes. So we have L1, feel that, L2, L3,
Yep.
L4,
Yep.
L5 goes all the way to the big toe,
Yep. Yep.
good, and then S1 is on the lateral aspect of the feet,
Yep.
and then S2 goes up the back.
Yep.
You feel both those?
Yep.
Okay. So that was the lower quarter screening for dermatomes. Now we'll do myotomes. So again, can you shrug your shoulders for me? Try to push you down. Good. So that's C4. And then try and push you in. C5. And then we have, can you flex your arm for me? Try and push you down. See? We have C6. And then Dawn, push you up. Good. C7. And then we have, Mike, you can touch your thumb to your pinky for me. Okay. So that would be C8. And then T1, can you try your fingers? Joel, let me. Let's see. Good. T1, so that was the upper body. And for the lower body, can you touch your knee to my hand? Don't push you down. Okay. On the other side. Good. And then we have, go, you extend your leg. Good. This is L3. Then for L4, you bring your right up here. Gently push your feet down. Okay. Okay. And then for S1 is against eversion. Good. Good. And for S2, Michael, can you lay on your stomach, please? You're gonna bend your knee. And I'm gonna try to pull you away. Good. And you're resisting his knee flexion. Good. Those are myotomes and dermatomes. All right, Michael, you sit up. We're gonna check your rapid alternating movement. You can just try to touch your nose as fast as you can with your fingers. Good. And then can you put your hands together and try to pull? Good. All right. So next, can you close your eyes? We're going to try sharp versus dull sensory. So what do you think that is?
Sharp.
Yep. We're going to test on both sides. And mix it up. What would that be?
Dull.
Yep. How about this?
Sharp.
Yep.
Sharp.
Okay, so now I'm going to check Michael's blood pressure, and to start that, I'm going to find his radial pulse. Okay, so find that. Going to place the cuff. Alright. Thank you. I'm going to place the stethoscope directly over where I found the pulse. I'm going to pump this up. I want to go to at least 180-ish. So, Michael's blood pressure is 130/78, which is within the normal ranges of blood pressure. So that is a good sign. So no hypertension here. So that's part of our assessment. I would like to check Mike's cardiovascular system. So Michael, can you lay back for me? I want to check your carotid pulse. So to get a better angle, I would check and make sure, I would inspect. Nothing seems abnormal. Michael, can you turn your head slightly to your left? And once I found his carotid pulse, which I do, and it seems normal. Okay, good. All right. So next I would inspect the precordium. So it's palpable. It should lie at the left midclavicular, which is right below. We'd find that apical impulse. And the impulse should last no more than systole and should feel gentle and have no heaves or flips. So then I would go start here. Now move over. Looking for any abnormalities in heart rhythm. And then go to the base of his heart. And I would look for any thrills. And all of that seems normal. Okay, so now we're listening to auscultations, and we're going to identify anatomic areas. So we're going to start with the aortic. And go to the pulmonary. Tricuspid. And the mitral. We're listening for any abnormality heart sounds. And another thing I'm going to listen for are the S1 and S2, which are the lub-dubs of the heart. I'm listening for any heart murmurs. That sounds normal. What we would do if Mike were to have a murmur is we would use the bell instead, and we would repeat the sequence over again. So next I would check the peripheral vascular system. So I would check the color of his extremities, such as his arms and legs. And check for any lesions or any abnormalities in sizes. Nope, okay. And then I would check all his pulses. So we have the radial pulse. Mike's is pretty strong. Check on both sides. Check with your fingers since your thumb has a pulse. Okay, and then you check for the brachial. It's right in here. Mike's is a little bit fainter here than his radial. On both sides. Both of those seem normal. And then I would check for his capillary refill. And we would do this by pressing down on his nails and making sure that the pink color comes back after pressing on all of them. Our concern would be if they don't refill within a couple seconds. Then I'm going to inspect his legs and palpate for any abnormal heat. Michael has sweatpants on, so his thighs are a little warm. His feet are a little bit colder, but normally hands and feet are a little bit colder as compared to the rest of the body. Also normal. So now we're going to palpate the pulses of the lower extremities. So for Mike's personal reasons, I am not going to palpate his femoral artery, but it would be right near the linguinal ligament. And then for the popliteal, sits right behind the knee. Okay, it's normal. Good. And we have the dorsal. Just a little bit harder to find. You're not always going to find it. Oh, this foot, I could find it. And then we have the posterior tib pulse, just right near the medial malleolus. Those are both normal for Michael. Okay. Now we're going to the respiratory. So just breathe normally. Try to set up with some posture. We're just checking to make sure that there's proper movement bilaterally when Mike breathes in and out. And then the respiration rate from when I was counting my last assessment. Mike has 12 breaths per minute, which is fine because the normal range is 10 to 15. And then, so I'm going to check his skin color. And for Mike, this is his normal skin color. Nothing's not too pale, not too red. Just right.
This is normal skin color. What are you trying to say?
And then, so Mike obviously doesn't have the best posture, but knowing him, I know that this is his regular body position. And his facial expressions, as tested before, are all functioning properly. He does not seem like he's in a lot of pain. And his level of consciousness, he's having full conversation with me, so he's okay. So, I've already palpated his lower body, the rest of his body. The skin temperature seems right. Nothing is too dry or too moist. Maybe use some skin lotion. Then we have...
ashy. Oh, damn, I am ashy.
I know, I'm telling you. And then, so there are no lumps or masses. But I can, if you want to lay down, Mike, I can check and make sure that there's no abnormal masses in any of your organs. Just where his liver would be. I'm not feeling any swelling. Nothing there is spleen. Stomach. That's tickle. Sorry. Sorry, I'm pressing kind of hard. Sorry. Okay. From what I could find, there were no masses found. Okay, so next we checked percussions, and we found no masses, but it's still important to check. So you would use 2 fingers down and 2 on top to tap. So liver, spleen, stomach. Then we're going to check auscultations. So Michael, can you sit up for me, please? And since he's sitting up like this, I'm going to check the back first. Okay, so can you just breathe normally, Mike? Nice deep breaths. Good. Deep breath. Good. Breathe. Altogether, there's 14 spots on the back that you should check. And now we're gonna do anterior. Can you set up for me, Michael? Cool. So altogether on the front, there's 12. There are no abnormal sounds, and sometimes with someone with asthma, it would sound a little bit different, and you'd hear almost like somewhat of like a wheezing. And then, so now we're on to abdominal, and I've already assessed Mike's abdominal organs. Everything that I know of is contour and symmetric. Umbilicus is fine. His skin, after assessing what I found so far, is normal, and there's no lesions. And so now I will check his bowel sounds to make sure that everything is working properly. Pulsation or movement is also normal. So we have the bowel sounds. We'll check all 4 quadrants. And sometimes what you'll experience is no sounds at all, and that means that there could be a blockage in one of his intestines. A lot of the time you hear gargling or high-pitched noises. That just shows that there's movement. Based off the sounds, Michael's large and small intestines are working properly. I will percuss all 4 quadrants, even though I did before, but just to make sure. Everything feels normal. And then I will also, just again to go over palpation since it's here, I'll palpate deeper, see if I can find any masses or abnormalities, or if it causes Michael any pain. By pushing down, there's no pain lower, means that Michael's bladder is okay. So now we assess for any bladder distension. So Michael, can you sit up for me? I don't want you to blow into your thumb. Okay, good. So Michael has control of his bladder and his bowel movements. So now we'll move on to medical history. So I'm grabbing my pencil to write down any important notes.
Soon, yeah, I got a little bang.
So we'll start with personal medical history. So Michael, how do you think your current health is?
It's okay.
Yeah, you feeling okay?
Yeah, not too bad.
Okay. Just tired with finals coming up?
A little bit of basketball.
Yeah, that too. Have you ever had any surgeries?
Yes.
What
I've
have you
had
had done?
2 surgeries. One on my wrist and one on my thumb. Both right.
Both right? So do you currently have any injuries or any medical conditions?
A couple sprained ankles, but that's
Okay.
about it. Nothing else that's serious.
Have you ever been admitted to a hospital?
Yes.
What for?
I had a lesion over my eye that I had to get stitches for.
So we're gonna move on to family medical history. So have you or any immediate family member had any major health problems such as cancer, any heart conditions, diabetes?
Has cancer. My aunt has diabetes.
Mm-hmm.
My grandfather died of a heart attack.
How old is he?
65.
Okay. And are you or any of your family members smokers?
My uncles are smokers. My grandmother used to be a smoker. And my grandmother had strokes.
Has anyone in your family ever suffered from high cholesterol or hypertension?
My uncle has high cholesterol.
So, do you have any sort of physical medical history? Do you have any health-related problems such as asthma? Or that
No.
so no asthma, no diabetes?
I'm fine.
You're good, nothing that you can think of? Okay. So recent general health status, are you on a diet?
No. Definitely
Do you use any tobacco products?
not. No. Do not.
How much alcohol would you say you consume in a week? Honest answer.
Estimate 3 beers a night.
Every night?
Yeah.
Just 21 beers a week.
Counting the weekends. I love binge drinking and drinking on the weekends.
Sure, it's really good for health.
Yeah.
How many caffeinated drinks do you have in a day?
1 coffee.
And do you exercise on a regular basis?
Yes. 2.5 hours every day.
Okay. And do you practice safe sex?
Yes.
How do you do that?
Right before you slap it.
Okay. So Michael, I think after looking over everything, after my full body assessment, I think you look good. But I might want to have you take an impact test, just in case there's any head injuries. It kind of looked like you hit your head pretty hard when you fell to the ground. So we'll see how things go, and I'll check in with you from there.
Can I put my clothes back on?
Yes, you can.
Cool. I know, I'll jump up and grab it. I just popped this shit out.
Alright, so I'm here with one of our basketball athletes who just took a nasty fall while attempting to make a dunk. I said dunk. Can we start that over?